Brady had a conversation with John O'Brien, the president and the CEO of the National Pharmaceutical Council. I direct your attention to the monitors.
I'm now joined by Dr. John O'Brien, who is a pharmacist and the president and CEO of the National Pharmaceutical Council. Many of you may know him as the senior advisor for drug pricing at the Department of Health and Human Services during the first Trump administration. The roles he has held across government, academia, and the biopharmaceutical and managed care industries give him a unique perspective on how policy impacts the future of health. Welcome.
Thank you. It's great to be here.
Dr. O'Brien, there is a lot of health policy in the news right now. Can you tell us what has really grabbed your attention?
Yes, but first, thank you, and thank the Hill, and thank you to Sue Peshin and the Alliance for Aging Research for bringing everybody together. This is such an important topic. When I think about what's next in health, I think that we're all going to be patients and caregivers someday. So it's so important to be focused on these incredibly important topics. When I think about my own journey in helping my parents with their health care, I can't help but think that we're living in a golden age of biomedical innovation. And when I was in pharmacy school 25 years ago, today's treatments would have been considered science fiction. And today there are millions of people who are benefiting from medicines that they didn't think that they would ever someday see to treat the diseases that they're living with. But unfortunately, we live in a system that's rife with perverse incentives. And what I mean by that is, I learned that medicines were something that could help people get well, stay healthy, and avoid more costly care settings like hospitals. And unfortunately, there are parts of our healthcare system that seek to extract margin out of drug spending as opposed to using medicines to help people get better. And many of the policies that we have today or are considering today in Washington may actually make this worse. So when I think about my last 5-10 years working in and out of government, I've heard from drug companies that have tried to launch a best-in-class medicine at the lowest price that pharmacy benefit managers didn't want to cover. I've met with patient groups who wanted to know why their Medicare Part D plan wasn't covering an important medicine after the manufacturer had lowered the price. And I've also met with leaders of pharmacy benefit managers who've told me that they've tried to offer low-cost solutions to the employer universe, but the employers may have actually preferred the rebates to the lower-cost medicines. So this is what all comes together to make me believe that we need as much innovation in how we pay for drugs as we do bringing new medicines to life, and I think ultimately patients are waiting for it.
So NPC's research focuses a lot on drug-related issues. We have the Inflation Reduction Act, 340B. What is your research telling you about some of these policy issues?
So NPC conducts high-quality research about the importance of patient access to scientific advancement in all of the areas that you just talked about. But I think there are two that are really important for the group that's focused here today. One, the Inflation Reduction Act. Our research has shown that that law has the potential to delay launches, reduce the number of subsequent indications or new uses for medicines after they're approved, to reduce the number of small molecule medicines that will be studied or ultimately approved, particularly in oncology or for people who are living with rare diseases. And that it's also going to have a chilling effect on the kinds of research that we see after a drug is approved, which is really important to doctors and scientists to help inform clinical guidelines. But when I think about the premium stabilization demo at CMS, or I think about the Congressional Budget Office and their new higher cost estimates, I start to wonder if this law is actually going to do more harm than good. We also do a lot of research on pharmacy benefit managers and health plans. And PBM reform is such a hot topic in Washington right now. I am really interested in hearing what Mark Cuban says next. He's actually shared our research from the American Journal of Managed Care with many CEOs and business leaders. And what that research shows is that employer benefits consultants and rebate guarantees may actually play an outsized role in the decisions that pharmacy benefit managers and employers make. And that payers may actually be preferring higher cost medicines that lead to higher total pharmacy costs because they like the rebates. We've also done new research on the role of copay offset programs like accumulators and maximizers. We've done a primer explaining that topic. It's new in Health Affairs Forefront, and I encourage people to check it out or to join us on April 17th when we do a webinar with patient groups to dig deeper into that topic. But if you share NPC's vision of today's treatments and tomorrow's cures being accessible to patients, valued by society, and sustainably reimbursed by payers to ensure continued innovation, you're concerned about these problems. And that's why the importance of continuing to develop good policy based on evidence is so important.
That's some really interesting information. Thank you so much for joining us today.
Thanks for having us.